Hi, Miss Giovanna. How are you today?
I'm good. How are you?
I'm doing good. Thanks for asking. So my name's Calyn. I'm going to be the nurse today doing your assessment. And I reviewed some information in your chart before coming in, and I see that you've been having some episodes of fainting, and you've just been really tired, and you just feel like you've not been able to catch your breath lately. Is that true?
Mm-hmm.
Okay. And you also started a new vegetarian diet recently?
Yeah.
Okay. And I also saw you were in school, and you've been having a lot of stress with school and have finals coming up. I know that can be super stressful. That's still something you're having to deal with?
Yeah, it is.
Okay. So I just want to ask you a few questions before we start the assessment, and I'll walk through the assessment as we go along, okay?
Okay.
So I also saw in the chart that you've been having some ear pain, and that's been affecting the way you've been sleeping at night.
Yeah.
Can you tell me a little bit more about when the ear pain started?
It was about a week ago.
About a week ago?
Mm-hmm.
Okay. And is it just hurting when you lay down at night, certain times of the day? Does it come and go? How long does the pain last?
The pain is mostly at night, but it still hurts pretty much all throughout the day.
And the other day you had a little bit of drainage coming out of it?
Yeah, it felt hot too.
Okay. And on a scale of 1 to 10, 1 being not bad at all, 10 being the worst pain you've ever felt, what would you rate your pain?
A 4.
About a 4, okay. And has there been anything you've done that's made it better or worse?
Worse is when I lay down, but
Okay. Nothing really better yet? Okay. Hopefully we can get that figured out today and get you feeling better. And can you tell me more about how that shortness of breath has been affecting your day-to-day activity? Are you still able to go to school, perform, do you exercise, hang out with friends?
I can still go to school, but I don't exercise as much anymore. I have to sleep with like pillows at night propped up, and then I just wake up really tired, so I just don't ever feel like exercising.
Okay. And you just feel like you can't catch your breath?
Mm-hmm.
Okay. And how much are you sleeping at night? I know you've been not sleeping as much because of the ear pain, but before the ear pain, with the shortness of breath and fatigue, were you sleeping quite a bit?
Yeah, but I just sleep like 4 or 5 hours now.
Okay. And since you started that new vegetarian diet, can you tell me more about, let's say, what you've ate in the last 24 hours? Can you do a recall for that?
Just beans and a salad.
Just beans and salad. You're still drinking your water though, right?
Mm-hmm.
Okay. Are you hungry or you just lose your appetite? Just not hungry?
Not hungry.
Okay. And how do you feel like you're handling the stress that you have going on with school? Do you feel like you're using good coping strategies?
I like to read. I do that a lot when I get really stressed with school.
Stress with school? Okay. And are you still smoking 1.5 packs of cigarettes a day?
I am.
Okay. And is that making you more short of breath too?
Yeah.
Okay. Alrighty, well I'm going to get some equipment, and if you don't mind, I'm going to give you a gown, and if you'll just put the gown on with your sports bra on top, and you can just leave your shorts or bra on, and then I'll be back in and we'll start the assessment, okay?
Okay, thank you.
Alright, Miss Giovanna, now that you're dressed and I've got my equipment, we're ready to start the assessment, okay?
Okay.
So first I'm just going to start by getting a set of vital signs. Alrighty. She'll just put this on your wrist for me. Ever had any problems with blood pressure in the past?
No.
She'll just hold it to your heart. And so while I'm assessing my client and getting the vital signs, I'm also going to be looking at their appearance. My client's well dressed, no signs of distress at this time. She's alert and oriented, and everything seems good. All right. 125/84. Pulse is 86. Just stick this on your finger for me. We'll get oxygen saturation. So what are you in school to be?
A nurse.
It's a good profession to go into. Got 98%. Alrighty. So now I'm going to take some body measurements, and this is just a way that we calculate body weight. So can you tell me what your typical height is?
5'5".
Okay. And how much do you weigh?
120.
And have you lost any weight since you've started this vegetarian diet?
I've lost a couple pounds, maybe 2-3 pounds.
Okay. So maybe around 118 now?
Mm-hmm.
Okay. So now I'm going to measure your arm. Do you have what arm do you write with?
My right hand.
Okay. So I'm going to measure your left arm because you always want to do the non-dominant side. So in order to get this, I'm going to determine the halfway point. So I'm going to measure from the top of the acromion process to the old cranium process. I get about 33 centimeters. So I'm gonna go halfway. And it's about 26.5 centimeters. All right, if you'll stand up for me, I'm gonna measure your waist. Do you care to lift your gown up for me? So I'm gonna measure at the waist, around right at the umbilicus. Okay, I'm gonna wait till my client exhales and then get my measurement then. And it's about 67.5 centimeters. Okay. Now I'm gonna measure the hips. I'm gonna measure the largest part of the buttocks. And that is 88 centimeters. Okay. And I would expect the waist to be smaller than the hip. So that's an accurate measurement. Okay, you can have a seat for me. And then at this time, I would also calculate the BMI once I get done doing my assessment, just to get a better idea of my client's measurements and weight ratio. Okay. All right, so now ever had any problems with vision?
Mm-mm.
Can you tell me what my name badge says? My name?
Calyn Richardson.
Perfect. Never had any blurred vision, never have problems with your vision?
Mm-mm.
Okay, good. All right, so first thing I'm going to do is just assess my client's mental status. And the reason I'm doing this is because I know you've been through a lot of stress with school and just want to be sure there's not anything going on that I would need to address.
Okay.
All right, so can you tell me your name?
Sarah Ubana.
Okay, and what about your date of birth?
11/29/6.
Okay, and where are you at right now?
The doctor's office.
And you know what today's date is?
Today is August 14th.
Okay, perfect. So my client is oriented person, place, time, and event. My client's sitting up tall, shoulders are back, posture is appropriate, facial expressions. My client makes eye contact with me. She does frown more often than smiles, which could be a sign of depression. Speech is clear, coherent, or easy to understand. My client's mood seems a little bit down. She's going through a lot, so that's expected. Feelings are expressed appropriately. Thought process is easy to understand. She follows directions. And cognitive ability so far, like I said, my client's oriented, person, place, time, and event. She's able to follow commands, and she has recalled all the events appropriately, so I have no concerns with cognitive abilities at this time. Alrighty, so I'm going to go ahead and start assessing your skin. Alright, so can I just see your arms? Okay. So I'm going to be looking at my client's skin color. With the fatigue and shortness of breath and not eating very well lately, I might expect to see some paler, maybe low iron or something like that. That could be causing the paler. The client is a little pale. I'll be looking for any cyanosis at the same time. Temperature is warm. Texture is smooth and even. No signs of edema. All right, now look at your legs. Smooth and even on the bottom as well. For texture, temperature is warm. I'm going to palpate for any edema. My client's skin immediately rebounds, which is normal. A little bit of paler noted on the legs, no cyanosis, no rashes. Feet look good with no edema. Alrighty, now I'm going to check skin turgor, so if you'll just lay down for me. Okay. So I'm just going to pinch up a little bit of skin by my client's clavicle. I'm going to let go, and it immediately bounces back to its normal position and recools, which is expected finding. And indicates my client's not dehydrated, and she said she's been drinking water. So I would expect to see that. All right, sit back up. Okay. All right, so now I'm going to go ahead and assess your ears, see if we can figure out more about what's going on with that ear pain.
Okay.
Okay, so first I'm just going to inspect the ears. Pull your hair back. Okay, the ears are even on both sides. They're equal in size. The auricle, I would expect it to align with the corner of the eyes, which it does on both sides. The tragus is intact and normal, and my client's earlobes are free hanging, which is a normal finding. Okay, so now I'm going to touch your ears and just let me know if anything hurts or is tender. So I'm going to palpate the auricle. Is that tender at all?
Mm-mm.
Then I'm going to palpate the mastoid process. Hurt anywhere? Okay, I'm going to do the same thing to the other side. So I'm going to palpate the auricle. Is this the ear that's been hurting?
Yeah.
No tenderness when I touch you? Alrighty. So now that I've palpated, I'm going to go ahead and get my otoscope, and I'm actually going to look inside your ears and see what I see.
Okay.
So I'm going to use my otoscope. First, I'm going to assess the auditory canal. I'm going to hold it with my dominant hand, and in an adult, I'm going to be pulling the pinna up and back to get a better look inside my client's ear. Okay. So when I look at the auditory canal, I'm just going to be seeing if I see any signs of earwax, a small amount of earwax, yellow in color. It's moist, and that is an expected finding, nothing abnormal. Okay. Same thing over here. Okay, again, small amount of earwax, it's yellow in color and moist. So now I'm going to go back and I'm going to check my client's tympanic membrane. In a normal client, it would be shiny gray, translucent, no bulging or retractions. But with my client, since she's been having ear pain, I'm going to expect it to be red and have some bulging, which could indicate an ear infection. Okay, so I'm going to insert it about 0.5 inches. And my client's tympanic membrane is red and has some bulging noted. And same thing over here. So have you been having ear pain in both ears a little bit? Mm-hmm. Okay. Alrighty. So now I'm going to test your hearing. So I'm going to stand 2 feet behind you, and I'm going to whisper a word and just let me know what you hear, okay? Do you have a good ear or a bad ear, or about the same? Okay. So you can pick which side you want to use first. Just use your hand and close one ear off. And I'm going to whisper a word and let me know what you hear.
Popcorn.
Okay, do the other side.
Football.
Alrighty. So that my client has no problems hearing. Have you noticed you've had to turn the TV up any more recently when you've watched TV or anything, the volume?
No.
Okay, so no problems with hearing. Alright, so I'm going to go ahead and put my gloves on. I'm going to check my client's mouth because I know you've had some cracks in the corners of your mouth. Are those recent?
Yeah.
So first I'm just going to look at my client's lips. They're pink, they're moist, skin's intact, no lesions, sores, anything noted on the lips. I do see the corner of the mouth, she has a little bit of a crack there. Okay, can you open your mouth for me? I'm going to be looking at the teeth. All the teeth appear to be there, no missing teeth noted. I'm going to get my pen light. I'm going to look at the cheeks of the mouth. Cheeks are pink and moist, color's even. The gums are pink as well. Can you say "ah" for me? Okay. The uvula is no redness noted on the uvula. The tonsils are present, they're pink. Okay. And the hard and soft palates are intact as well. The hard palate was a little bit pale, which is expected, and the soft palate was pink. Okay. Any other problems with your mouth besides the cracks? Okay. Alrighty. I'm just going to discard those. Go ahead and wash my hands. Alright, so I'm going to listen to your lungs, and I just want to do this since you've been having a hard time breathing and see if I hear anything abnormal. So first I'm just going to inspect your chest shape. So first I'm just going to slip your gown down so I can see your chest better. Okay. Keep it covered up as much as I can. So I'm just looking at my client's chest shape and the skin. The skin is intact. It's warm and dry, nothing abnormal noted, no lesions, no rashes. It appears that my client's chest shape has a ratio of 1 to 2, no signs of barrel chesting noted, and that is normal. Okay, so now I'm just going to assess my client's respiratory rate. I'm going to tell my client that I'm checking their pulse, but really I'm going to be looking at their respiratory rate. I just don't want them to change their pattern of breathing. And I would expect my client to have breathing anywhere from 12 to 20 breaths a minute. That'd be normal for an adult. Okay, so my client's rhythm is regular, the depth is normal, and she is breathing about 16 breaths a minute. Okay, it is quiet, it doesn't appear labored at this time, and I'm also going to be looking at my client's intercostal spaces and see if I know any signs of retractions, which would indicate labored breathing. Again, my client's breathing fine, no signs of retractions, and she hadn't been complaining of having difficulty breathing, so that's expected. Okay, so now if you'll just take a deep breath for me. Okay, I'm checking chest expansion. I would expect my thumbs to be symmetrically apart, which they did. Alrighty. So now I'm going to palpate my client's chest. So just let me know if any of this is tender or hurts, okay? Okay, nothing hurt? Alrighty. So now I'm going to percuss my client's chest. And I'm going to start on the left side and move to the right. And over healthy lung tissue, I would expect to hear the resonance tone. And over breast tissue, it may be dual, which it is. Alright, no problems there, nothing hurt? Okay. I'm going to go ahead and listen to my client's breathing. I'm going to listen to one breath sound at each spot and see if I hear anything abnormal. So if you'll just take a big breath for me through your mouth. Alright, so as I was listening to my client's breath sounds, I noticed she does have a little bit of wheezing present, and that could be another reason that could be indicating why she's been having some shortness of breath. Alright. And I'd also check skin turgor here, but I already checked it earlier with skin, so we're going to go ahead and move to the back. And I'm just going to do the same thing on the back. I'm going to listen to your lung sounds again. Alright, so first I'm just going to be looking at the back. I'm going to inspect the scapula and the shoulders. I would expect the shoulders and the scapula to be equal at horizontal positions, which they are, and the scapula are symmetrical. I'm also going to be assessing to see if my client is using their accessory muscles to help with breathing, which would indicate labored breathing, and again, my client's breathing is quiet, no signs of distress or labored breathing. Alright, now I'm going to check chest expansion in the back again. I'm going to put my hands around the T9, T10 area. You'll take a deep breath for me. I expect my thumbs to be symmetrically apart, about 5 to 10 centimeters, which they did. Alright, so now I'm going to palpate on the back again. Just let me know if you feel anything tender or painful. Nothing tender or painful? Okay. Alright, so now I'm going to percuss like I did in the front. And again, over healthy lung tissue, I expect to hear the resonance tone, and over the scapula, it will be a flat tone. Let's start left to right. Okay, I'm going to go down to the intercostal spaces. So now I'm gonna listen to your breath sounds on the back. If you'll just take a big deep breath through your mouth for me, I'm gonna listen to one breath in each spot. Okay, and as I was listening to my client's breath sounds, they were a little bit diminished in the back. I heard some wheezing on the right side and no other sounds noted. Okay, now I'm going to auscultate. So I'm going to listen to my client's apex and left sternal border of the heart as she breathes out. So I'm going to go back to the front. She'll just breathe normal for me. Okay, perfect. Now I'm going to touch her back in 2 spots and just tell me where I'm touching you at. So can you tell where I'm touching you at right now?
The top,
And what about now?
bottom,
Okay. And,
the middle, and the bottom.
okay. Alrighty. Alright, do you have any other questions for me? I'm going to slip that back on. No other questions? Alright, well I'm going to step outside and look at some of the data that I gathered, and hopefully we can figure something out and get you some medicine and get you feeling better, okay?
Alright, thank you.
It was nice to meet you.
You too.
All right.